Good evening from New York. I'm Chris Hayes. Everyone has been asking the same question. I know I have. How bad is the pandemic going to be? And there's all this data flying at us from all over the place. There are a million different variables, and just about the worst person possible is running the country. So as I spend all my day reading and texting and talking to experts and to sources about this crisis, I find myself mentally putting things into two buckets: the good news and the bad news, as a sort of framework when thinking about this whole thing. So tonight, we'll start with the good news. We are actually ramping up testing capacity quite a bit, quite quickly here in the U.S. We still have a ways to go, but we are heading in the right direction. This graph shows our testing capacity, and it really is impressive because it shows you what can happen when you unleash the full capacity of America. You can really test a lot of people. In fact, it makes it all that more frustrating we did not start doing that earlier. We should have been doing this a month ago, like South Korea. But the good news is that we are testing much more day after day after day. And as that is happening, multiple research teams, one at Mount Sinai in New York, one in the UK, are starting to develop an antibody test that would allow people to know if they had the virus in the past and are now immune. And that is absolutely crucial when we are through the worst part of this and get back out into the world. So that's good. Another silver lining is as confirmed cases and fatalities go up, both of which have been brutal, especially here in New York, the overall fatality rate in the United States is really, really far below Italy and Spain, particularly in per capita terms. Now, we don't know the whole answer on why that is at this point, some of it probably demographics. It is something also that could change in the future. And it is certainly not a consolation to the families and friends who have lost dearly beloved family members. But for now, it is something to take some measure of comfort in. Today, as more horrific numbers came out of Italy, there is a bit of good news there as well. It is clear their curve is flattening out. 2 weeks after the country declared a strict and total lockdown, Italy has an 8% increase in confirmed cases daily. That seems high, but it is better than the 20 and 30% daily increases from only a few weeks ago. Another good thing, the basic supply chains in America appear to remain intact. There's a great article in Texas Monthly about how Texas grocery chain H-E-B started planning for this far in advance of the Trump administration. In terms of the federal government, the Senate did pass a $2 trillion rescue bill unanimously, somewhat remarkably. There's a lot in there, some good, some bad, some ugly, but there is going to be some financial relief, some cash assistance, beefed up unemployment insurance coming people's way. That is the good news. Now the bad news. The bad news is the U.S. continues to have the highest rate of growth of the virus of any major country. In fact, just a few hours ago, in a grim milestone, we officially passed China and Italy to have more confirmed cases than any other nation in the world. We've also crossed 1,000 fatalities. New York added just 100 since yesterday. While fatalities have been concentrated among older people and people with comorbidities and pre-existing conditions, there are lots of brutally sad, gutting, terrible cases of younger people dying as well. A 48-year-old nursing assistant at Mount Sinai West Hospital in Manhattan died yesterday. Photos shared on social media showed nurses at the hospital wearing plastic garbage bags as personal protective equipment, because we still do not have sufficient equipment to protect all the doctors and nurses and frontline healthcare workers. The doctor I talked to today in one of the New York City hospitals has been wearing the same mask for 4 days. And there are still widespread fears of infections growing among hospital workers. Here's another bad thing. We are now entering the phase where the hospital systems begin to get overrun. Now, we've been warned about this phase. We were warned by the doctors in Wuhan, in China, and in Lombardy, in Italy, and now it is happening. There are some New York City hospitals that are already at capacity. This is what an emergency room doctor in Queens told the New York Times.
Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying. We are right now scrambling to try to get a few additional ventilators or even CPAP machines. If we could get CPAP machines, we could free up ventilators for patients who need them.
And from our perspective, everything is not fine. I don't have the support that I need and even just the materials that I need physically to take care of my patients.
The virus is still also spreading all over the U.S. New Orleans is looking more and more like a real hotspot. Louisiana's governor has compared the state's trajectory to that of Italy or Spain. And it makes some sense that a month after Mardi Gras, New Orleans would be a hotspot. A former health director in New Orleans told the New York Times, quote, "The greatest free party in the world was a perfect incubator at the perfect time." We got some more bad news today in the form of unemployment claims. They came in at 3.3 million, never in our nation's history. Well, at least since we started collecting data in 1967, have we hit a number that high? It just completely blows up the charts. You can see here the previous biggest number was in 1982 with nearly 700,000 claims. Even the peak during the Great Recession hardly even makes a showing on the chart compared to this number. We are, quite literally, in uncharted territory. And what happens from here depends on the actions we all take as citizens, as humans, the actions of civil society, and of our political representatives.